So what we like to do after these performances is have a little bit of a panel discussion where we can hear from some people who are doing this work, who are either continuing on the work of the COVID hotels or doing work that's similar to that. And I'm going to let everybody who's up here with me introduce themselves and tell us a little bit about what you're doing right now, first of all.
Okay, I guess I'll start it off. Hello everyone, my name is DeShawn. I'm one of the case managers here at Safe Landing Interim Housing. So here we provide temporary long-term shelter for homeless participants and assist them with finding housing as well as mental health stabilization and connecting with a PCP as well.
Hello, my name is Christian. I'm here as a team lead. I've been in this field for about 10 years. And then here I help support the care managers in making sure they complete their applications, get clients connected services, and ensure that they get the care that they need, whatever it might be. And so we just try to make sure that they have those linkages. And then if there's issues with housing, also assist in like troubleshooting those as well. It's not always the best, but sometimes we try hard enough, we can try to get these people housed.
All right, my name is Dr. Jerry Abraham, and I'm a family and community medicine physician. Also work in public health, and I currently work at KEDREN, which you may have heard of. It's an acute psychiatric hospital, federally qualified health center, and historically black institution in South Central, South LA. I'm also faculty and teach at the Charles R. Drew University of Medicine and Science. You may have heard of that. It's a historically black medical school right here down the street in Willowbrook. And during COVID, we started a massive vaccine program that ended up vaccinating over 400,000 people in South LA. But to your point, we wanted to figure out how we can continue this work beyond just the COVID pandemic. And so one thing that we did was pretty early on, when the lines started to get smaller at the hospitals and clinics, we realized we needed to go out in the communities. So part of it was taking mobile units, taking the vaccines and going to where people live, work, worship, play, where they go to school. You can imagine there are folks that are homebound, there are folks experiencing homelessness, so could we come to shelters, meet people where they are, and then could we also address other issues besides COVID? So how do we help people that need help with their HIV medications, for example? There are people who have mental health diagnoses that need help in the community. We have some patients actually here at Exodus, so it's actually a place we come to and see patients. We have people that are struggling with opioids or meth, so how can we go to them and provide those services? We have people that are coming in and out of prison, probation, parole, how do we help those folks out? And it just goes on and on and on. And so can we meet people where they are and also help them with kind of the conditions and the realities they have? But really glad to be here with you all. This is an amazing campus, honestly, and we're just so thankful there are places like this, and thankful that all of y'all are taking the time to have these conversations, and really appreciate the performance as well. Thank you.
Hi everyone, I'm Patricia Motus. I work here at Safe Landing. My role is an occupational therapist, and my main responsibility is really to coordinate activities throughout the campus. I've been here from the beginning, so going on 3 years, and I've really seen the facility go through some changes, staffing, and all sorts of changes, growing pains. This facility opened after COVID, so I would think that it's sort of a product of some of these initiatives that were started during COVID, and perhaps some of the protocols were then, applied to this setting. Thank you so much for the performance. That was very moving, it really was.
So, why don't we start by, I know that some of you have already talked a little bit about your experiences during COVID and what you saw coming out of it. I know, Christian, you were sharing before the panel too that you worked in the Vagabond, who was like, well, that looks really familiar. So, if you want to say anything, maybe we could start on the other end and go this way this time, because you were talking about how this came out of maybe some of the COVID experiences, and then if you want to talk a little bit about how this place grew up as well.
Yeah, so this place was not open during COVID. It actually opened after. In fact, I think the opening date was postponed because of COVID. Many things kind of took place and that didn't happen. I've been working with this population, with the unhoused population for over 20 years. Most of my career experience is in New York. So when COVID happened, I actually was not here in California. Well, I was transitioning from New York to California, but not necessarily working in a clinical setting just because of the circumstances at the time. So I can't speak too much to, how, to speak too much to your question. But I do know that, just in sort of observing the performance today, COVID, it's impacted people in so many different ways. And I said it was such a moving performance before because a couple of our audience members were actually significantly moved and, were quite emotional afterwards, which really reminded me of how challenging that time was and why we all had to kind of come together and do a variety of things, different things, creative things, right, to make it work for people. So, that's what I'd like to share.
Yes, ditto to a lot of what you said. I think some of the challenges that we face were the people that are either most hurt by the healthcare system and by public institutions are the ones that may be the most reluctant to come and seek care or, for example, roll up their sleeves, get a vaccine. So I think early on we had to learn how there's a reason why people don't want to come to hospitals and clinics, and that, we could stand there with our arms folded, crossed all day long and just be like, well, where are they? Why are they not coming to us? Why are they not getting their refills or getting their meds or getting these tests done or getting their vaccines, right? And that's just such a, I think the play really speaks to that it's, we need to change kind of the way we think about a lot of this and the perspective and the systems in place. I may not want to come to you. Maybe my grandmother's told me to be afraid of y'all. Maybe you've actually hurt my family. Maybe you denied a loved one pain medicines when they needed it, or I know a mama that got hurt when she was trying to have a baby at your hospital, so no, I don't want to come there, right? So you start to realize, okay, there's a lot of barriers, and so now what can we do to address them? I think going to where people feel safe, and for better or worse, that is definitely in the community, and for some people that might even be at an encampment on Skid Row, to be honest. I might feel safer there than in some of this very pretty building we're in right now. And you do understand that people are coming at this from such different places. The last things I'll just say, we have to rethink a lot of how we deliver and how we care for people. Let's just leave it very simple at that. There are so many barriers to getting the care you need, whether it's treatment, medicines, that visit with someone who can help you. So I don't have any answers to this, but we know a lot's happening in DC right now. There's a lot happening in Sacramento, and we need things like Medicaid, right? We need health insurance. We need Section 8 vouchers so we can get off, get up on our feet, get off the streets, right? These programs really change lives and make a difference, and it's just really sad that so many people want to cut them or destroy them right now when we clearly see, even right here at Exodus, how it's helped so many people.
So for me, I just want to piggyback a little bit on that one. People like to stay where they're able to build their community, right? And that could be anywhere. If someone feels accepted for who they are, their past actions, whatever it might be, they're more likely to stay. And now if you have a peer that's telling you those things, they're more likely to want to make that change for themselves. And so with that community, it's extremely important. And so that's why here at Safe Landing, we try to do that, try to assist the clients, promote, our OT groups to go out, also promote that socializing, because a lot of these people that come are homeless and have been homeless for a long time, and so they're stuck in survival mode. And survival mode looks totally different than when now I'm living by myself, right? Totally different skill sets that you need to have, because in the streets, it's different. You literally have to survive day in, day out. And versus then when you come into Safe Landing, then it's like, okay, now there's rules, regulations, and now to piggyback on the quarantine sites. And so even then we've had clients that had come in briefly, some that did want to stay, some that didn't want to stay. But then once we were able to try to explain the program and the things that were going on there, they were more likely to stay. So they did do a lot of that harm reduction. I know if there was a few clients that to some extent had issues with anxiety, and so they would self-medicate with marijuana. And at some points our doctors there were able to then prescribe that, however much, to make sure that they're able to quarantine safely. And so that was, I thought, really important, and as well with like alcohol as well, because we're not denying it to them. And if that is a barrier to them, that is why they eliminated that barrier. And I thought it was a great idea to have, especially for harm reduction, because if they are going to do it here safely, or they're going to do it out there, I would prefer to have them be here safely with the nurses, with the doctor, case managers also assisting with making sure that they had safe linkage to a shelter or another permanent housing that they were working towards. And so those things I'm able to see, especially in our triage, since we are doing those things exactly. So a lot of those services where we would try to link folks who didn't have shelter, we were able to link them and create partnerships with different providers in the area. And so now that's exactly what we're doing, except working directly with DHS to make that happen. So it's more streamlined than how it was before. And yeah, it's nice to see that some of those processes have been, I wouldn't say fixed, but made more efficient. And so, let's see, what else can I add there? I think that's it, yeah. But it's nice to see the changes and how we are starting to make sure that clients also get housed over here, although we still have our limitations with funding, right? If we could give everyone Section 8 vouchers, we would. If we can house everyone, we would. But sometimes that's not how it works. The CS system is not very efficient, and prioritization isn't always the best, right? Some clients can work and still not get the services that they need. So, it's something that we're still working towards and trying to make sure that we help the clients when we can. Thank you.
Well, Christian actually stole a lot of my information I was going to speak on. You didn't have to elaborate that much. You could have left me something, but my COVID experience was kind of different, I would say, because I do have my commercial license. So I worked with people with traumatic brain injuries. So when COVID did occur, I actually was not vaccinated. So I lost my job. But luckily I have my commercial license, so I did get back on the road for about a year or two, I would say. And then I started back here with Exodus. And I never seen a program with so many services, I would say, or opportunities for participants to stabilize and also progress in such a significant way, I would say. But this is a great program. They offer a lot of services, and it's a great place to be, I would say. So don't give up, just keep pushing. Patience is the virtue.
Yeah. Okay, I'm going to ask one more question, and then I know there are audience members who have questions. That was really, to me, inspiring to hear about just how things have grown out of COVID, and also all of the things that are in the works right now that are new or that might be changing or transitioning as we speak. So I want to ask each of you just what do you see for the future, for your ideal future? What would you like to see more of that's happening right now, or what would you like to see change that maybe is happening right now but that is not working in healthcare and housing specifically?
I could start. I think, and this might sound, a little pompous, but occupational therapy is not in many shelters throughout the country. Throughout my career, that has been my main role, is starting occupational therapy programs in a variety of interim housing facilities. Most of it was in New York. This is my first one in LA. So I'm really proud of this. I think that we add value to what the clinical services that are offered here. We sort of bring a different set of lens, a different perspective, and really complement the greater whole and the team. So I hope to see more OT in places like this. There certainly are a lot of therapists who are interested in this type of work. So the idea is to, just kind of spread the word and to help people understand our value and how we can, again, complement the big picture.
I really appreciate that because we have a lot of occupational therapists in the acute psychiatric hospital setting. So I don't know if y'all are familiar with it, but it may be in some ways the epitome of a lot of the things that I think patients are frustrated about. A psych hospital's probably got the most restrictions you're going to see, right? You're definitely not coming in with your belongings. You're probably going to have to change into, a jumpsuit that almost feels like you're in prison sometimes, right? You're being poked and prodded and given medications you don't even know what they are or why you need them, or blood's being taken from you. I mean, it can feel like a very violating space. So I will just say the play reminded me of what patients must go through when someone's going through all your belongings, because I see it every day at the hospital, right? I mean, it's very much so feeling violated, right? That's all you have.
Yeah.
And you're telling me I can't take it with me, or, I have to leave this, or the only thing in this world is my doggy. And you're telling me I have to figure it out, but you got to get rid of it in order for me to help you, right? So it is kind of strange. So I do hope we see more occupational therapists everywhere. I will definitely take that feedback back to our hospital as well. I'll say something neat about this campus is that you don't feel like you're in an institution. You don't feel like there's something wrong with me and I've got to be here in this, concrete jungle and feel like, I don't know, are they going to help me or not? Will I be able to not navigate these places? So, one take home from the play for sure is how can we do this and more of this and throughout the county? Clearly money is a limiting factor, but that probably would be a big part of the solution as to why so many folks feel like being on the street is better because they don't have access to this.
Yeah.
And the things that they do have access to are not going to meet their needs or accommodate maybe their preferences or lifestyles. We're building a children's psych hospital now. Instead of calling it a pediatric psychiatric hospital, we're calling it a children's village, and so that way people's parents can come live with them when they're in the hospital. So imagine little kiddos that are needing to stay in a mental health hospital. Imagine being able to come with your siblings, your guardian or your parent, being able to play outside, grow food, to play basketball or be outside, outdoors, nature, around trees. Those are just things that people don't get to do when they're in a lot of these facilities, right? So in an ideal world, in a reimagined world, how neat would it be if we could all find something like this, a summer camp experience, a place where we feel happy and safe and can get better. And that would be my ideal.
No, actually, that sounds great. No, because you're right. Because once people go to like inpatient, you're basically isolated. So you're basically forced to build community with the folks that are inside, but also it's still isolating for them because at the end of the day, they still miss their loved ones on the outside, right? So I totally agree with that. For me, it would be working with more multidisciplinary teams. So I know they've already been rolling a lot more of those out with other programs, but that's one thing I've always enjoyed because I get to learn more from the other disciplines, learn from the nursing staff, the doctors, outreach workers. Everyone has a different opinion on how to better assist the client. And one thing that I've noticed is good bedside manner, honestly. Being able to treat people with respect, regardless of where they come from. And you get a much better reaction from them instead of, saying one thing, right? Sometimes we've all had that doctor once upon a time that tells you just the straight facts and it doesn't come across, right? Because of the bedside manner, right? So it's so much easier to take in when they explain it to you and you're able to then take in that information and go like, okay, I understand now, versus how, dry it can be sometimes. And so that's something that I would want more for our clients, and ensuring that they understand, you know, things that are happening, the reason why we're doing these resources, and continuing working with multidisciplinary teams and ensuring that they're able to get the assistance that they need. Of course, I can say more funding, just because it's so limiting. I know the PRKs, PHKs were pretty good back then when we had the funding for it. I wish we could just go back to that some more. I know that slowly they're changing them so that they're now able to match them to those units. So now it's a little bit better as far as permanent housing. But again, the limiting factor is always going to be that, financial. So it would be hopefully have enough money to be able to house everyone, and then get the next rotation. So, unfortunately, homelessness is one of those hard to tackle issues because it can happen to anyone.
For me, I actually worked at numerous facilities, but nothing compared to this. So having more facilities that are equivalent to this would be very beneficial to other participants because of all the services and things you can do here. When you're here, you don't actually feel like you're in a homeless shelter. If that makes sense, because you still have your own privacy. You can leave at your own free will. You have a cafeteria, OT, which can be seen as the educational room in a sense. You have wellness center or different therapists, and you have case managers. So I kind of look at it as a university campus. You're here for a while, and then you're transitioning to your next step, which is housing, or maybe you've been working, saving up your money, now you can get your own apartment in that sense. So I would like to see less homelessness and more facilities that have the resources that this facility has, so we can see more people with progression. That's what I would say.
Yeah, I think that's what the play would like to see too, and all of us for sure. And in every neighborhood, I think something that you said before, Christian, about people building community, and people, have an instinct. Everyone does, where we want to be where we feel safe and around the people who make us feel safe. And so that's why it's so important to have a space where you can go in the neighborhood where you feel safe without having to go to a completely different part of the county.
Yeah.
So
I would like to add to that really fast, because one of the issues we have too in teaching the folks who do get housed eventually is because they spend so much time with the people that are here, they haven't had time to get ready for that permanent housing. Mm-hmm. And it's about getting them ready for that. Now it might feel like isolation. So it's like you're at the end of the tunnel, but now I'm by myself. So that's a whole nother thing that we need to just teach folks. Yes, this is the prize at the end, but we need to make sure that we're ready. We have a support system in place. Yeah. So in case I do feel isolated, I know who to reach out to.
It says so much about our larger culture too, that it's isolating to go back into that space of being housed and secure. Yeah. So I'm gonna open this up to the audience for questions that you want to ask. I know we had some. Did you want to ask a question, or were you?
Question.
I really appreciate this facility. It's been a big time lesson for me. And they've been helping me. I do a lot of research. I have a brother who's very, he has his own radio show. He's connected with all naturopathic and a lot of doctors, world famous. And I really do research big time. COVID was purposely put in by our own government and spread worldwide. Location called population control. Vaccine. You know the ingredients for the vaccines, right? They're not pretty. HIV, cancer, AIDS, you name it. That's the attitude. So, with all that in mind, it's I hear this stuff on TV all the time. Come and get your COVID shot. Come and get your shot. Come and get your shot. Really? And I even had a lot of my friends get that shot, and die like about a week later. Population control, baby. And that's a fact. I don't care what the doctor tells me. It's like, the other day the doctor tells me, I go, hey, I'm having problems right here in my chest, right? I go, the condition going on, right? And she goes, oh, what you need to do is you need to get a lobotomy or whatever, some stupid shit, right? And I'm like, I don't think so, lady. Just give me a couple like anti-inflammatory pills and I'll be fine. Maybe a couple of meds like make me feel happy. But anyway, that's one really rough discussion for me in the medical field. It's like another personal
Well,
doc.
that's why I said what I said
But
about a lot of people
it's
don't want to
like,
come and
you
visit
know,
us, right? A lot of good reasons why people don't want vaccines.
Pharmaceutical companies, okay? I don't work for, but I'm supplying them, making sure they're getting paid.
It's definitely a capitalistic system where lots of people make a lot of profit off of the healthcare
Oh
system.
yeah,
So
and
there's,
they make profit on people dying.
there are definitely real reasons why people have reservations about, well, how do I know this is really in my best interest, especially when we were dealing with a novel, new virus that none of us really knew what to do about, and we saw people that were getting hurt or dying. So then, it's like, and now I'm supposed to trust this new miracle drug, right? It was a scary moment for a lot of us. What I will say to this, because I do deal with a lot of this, whether it's on Skid Row or in the hospital, in prison, you can imagine all the different settings that my team takes care of people. We really want to meet people where they are. Most importantly, we're not trying to do things to you that you don't want. I believe these are all conversations. There's still a lot of work that needs to be done to answer people's questions, to rebuild trust. If somebody says, well, I can't trust you because what have you ever done? What good have you ever done for me lately? If we can't answer those questions, why should you roll up your sleeve? But I do want to be here as a resource. We do want to answer your questions the best we can. And ultimately, I respect your decision to do what you have to. There are times when we do things because we have to protect maybe society as a whole, children, a family. For example, my patients that we hold involuntarily in a mental health hospital, right? There's a reason why we have to go through some of those steps sometimes. It doesn't change the fact that it's absolutely frightening. You mentioned kind of like survival, right? Survival on an encampment in Skid Row. There's survival in those first few hours in a psych hospital. You don't want to be here. You're being held against your will. You can't get out. You don't know anyone here. All your loved ones, all your belongings are not with you, right? So same thing in prison. We've got patients in prison. It's a whole nother level of survival. And then you say, now go figure out how to live by yourself because we got you housing. So these pieces are all very disconnected, discombobulated, broken. It doesn't feel seamless. Places like this might actually help us get to where we need to be.
This place is a blessing. My question to you is, do you recommend getting vaccinated?
Oh Lord. Well, a physician, I went to medical school. I respect that. I really respect that. One thing I do want to mention quickly, by the way, and none of us have really mentioned, and I also cross paths with Urban Voices Project, which is a choir with people experiencing homelessness. Some of you guys sing in the choir. Some of y'all are part of some of the other programs, Skid Row, Arts Alliance. This is amazing, the LA Poverty Department. I'm going to answer the question, but I did want to say I am very thankful that art is a part of healing. And I hope everybody at least takes away from this that you too have it in you to make music, to sing, to dance, to play. And that may be a part of how we better transition to living alone or to reintegrating into some sense of society, family, culture, whatever it is. But I really hope that one of the takeaways is like, where is art in your life? It needs to be in my life as a physician, in our lives as people, as whatever it is that you do, a scientist, an Uber driver. Is there art in your life? That may very well be a part of the antidote to making us feel better, to making us feel safer. The last thing I will say is, yes, I'm a physician. I'm a primary care physician. A lot of what I do is take care and make sure babies get vaccinated, and it's helped people not get measles, mumps, rubella. There's all sorts of things people haven't gotten. Polio. We've eradicated smallpox because of vaccines. Okay, so these new ones are different, but I will say it's hard for me to make any sort of blanket statement that I do or do not support vaccines, especially when so much of what I do is try to help people make sure they get the medications they need in order to stay safe and healthy. And I will tell you, we can agree to disagree on this. I've definitely had patients get the vaccine, and I definitely know that it's helped some patients. So, we got to kind of balance all those different pieces of information. No, but I appreciate you challenging me. Someone has to. Thank you.
Anyone else?
Yes, burnt on out. Burnt on out. Dozens of my caseworkers, 4 of my doctors, lost our clothing, SROs in 29 housing. What are you doing from stopping to be burnt on out? Where is your way of hope? Where is your light? And what are you doing to get funding for like LAPD, who has lost their money, so many other organizations that I work with?
Our LAPD.
Los Angeles Police Department, not the police department. That's very important.
I will start off by saying I did think about that. I was wondering, like the play, it kind of hinted a little bit about the burnout piece.
Yeah.
How many times we come back to a place like this and go, that social worker no longer works here, that case manager is gone. I mean, we see it all the time in Kedren. It is hard.
My case manager did.
Yeah, it is. There's
But she's not here to do anything anymore. But look, I've had 10 parole officers in the last 2 years.
Yeah.
Our system's fucked up, man.
No, I get it, but here's the thing.
Our system's fucked up,
To
man.
his question, part of her boundaries and keeping her sane and keep her coming back may be that she leaves at a specific time. Maybe she doesn't take the work phone or turns it off at certain times. I mean, it's not easy. There has to be some boundaries. I think it's both sides too. There has to be give and take on the public, the client, the physician, the person trying to help side, as well as the people trying to help. It's like a little negotiation, a dance we're doing with each other. And the more we respect each other, I am very worried that people doing the work are burning out and not coming back. So we do need to make sure, are we keeping them safe? What is it that keeps us healthy? Is art in each of our lives? Like all those things are gonna make us be, I hate to use the word resilient, but up for the next challenge, up for the next pandemic, be able to come back the next day and still make a difference.
After you get people housed, man, how do you keep them in their housing?
Yeah.
How do you keep them in
You
their
refer
housing?
them to
Look,
wellness.
because let me tell you here, 80% of the people here are getting set up for failure because they can't buy their own soap, they can't buy their own toothpaste, look, man, people been here 2 years, man, and still getting razors. Buy your own fucking razor, man. Buy your wash detergent. Buy your shampoo. How are you gonna pay your rent, man, if you can't get these simple little things? And what we're doing is like coddle people. There's no consequences. You come in drunk, you come in fucked up, there's no consequences, man. You sit on the fucking, you pee yourself, and ain't no consequences.
No, what I will say
And the harm reduction does more harm than good.
I hear you on the occupational health side.
There's no
That's actually a
recovery
big
here, man.
part of what this discipline is all about. Occupational health really is about helping us get back to those basics. As my team knows, there are 2 categories we talk about: activities of daily living and then the instrumental activities of daily living. Yes, we need to be able to figure out how to use money, how to be able to go shopping. Can we prepare my own foods? Can I dress myself, bathe myself, hygiene, right? Those are all things, and that's why the team that, remind me your name one more time? Patricia's developing is helping people learn those life skills. Some folks did not get that training or just don't have that life skill. And we need to help them. So yes, there are people out here that probably don't know how to buy laundry detergent, but I promise you it's something that we can figure out together. That should not be a barrier to them getting a house.
I just want to say about burnout. It takes a lot for people to come in and continue to assist, even when they're getting yelled at, told that they're not doing anything. And so for people to still come in to do the work, it's hard. So I don't think it's fair that you can say that about the staff. It's hard. The work is hard. It's reflected in why people leave. it's not their fault. They're choosing to protect themselves.
Yeah, no, that's understandable. You know, look, once you guys get us housed here, you cut all ties.
Okay, can I say something?
But the thing is, that's why we try. Again, we can't force people to learn. We can try to teach the life skills, how to do what they need to do, so that when they get out of here, they're good to go. But the thing is, not everyone is there when they get their chance for housing. All we can do is allow them to try to learn their independence when they go.
I think this person has been waiting to respond to.
Hi, you guys. I'm Egypt from the Wellness Program. So for you, I would like you to utilize your resources that are all around you. We have Patricia. She helps with.
I do utilize it.
So she helps
I
with.
partake in my recovery.
And then we have wellness program that helps you after you get your housing. They help you with individual therapy. They help you maintain your housing by giving you injections for whatever you have going on. So if you want, you can come visit us. We're just right here.
I visit you guys all the time.
You know, so you know,
I visit you guys all
the resources are here. We can't force you to go get the resources. We can only
I do my own footwork.
You know, so yeah. For us, I think a lot of us, we don't have therapists. We're here 24/7 a day.
Yes.
Sometimes when we leave here, the work does not leave here with us. We love the work that we do. We enjoy the people that we work with.
You guys treat us all the same.
Do I treat you the same?
You guys treat us all the same. No, you guys treat us all the same. No, you're nice to everybody.
Okay.
I just don't understand how people are always like Alex, you know, in the wheelchair, just yelling at staff all the time, or this guy. Sorry, Stuart, put it in the book.
No.
But I mean, this guy, he don't act his age. He don't act, what 70-year-old man argues with an 18-year-old kid and shit, man?
Okay.
You know, come on, man.
Everybody's
Gotta grow up.
I think what you're seeing is the obvious, right? Which is like this is a diverse group of people. We all come from different walks of life, different experiences, different upbringing, right? Different values. So it's impossible for all of us to behave in the same way. So I saw a handout today about expectations and what we should expect from each other, right? And whether we really have the right expectations. Were you there at that group where the handout was? So I think places like this require tolerance, right? The big T word. So we have to be so tolerant of each other because we're all going through different things. We might look the same, but we're all going through such different things. And that's why people are dealing with their stuff differently, right? So when you see somebody struggling,
I try to pick them up.
help them, tell us so we can help them, because that's our job, is to help them, right? Rather than complaining about them or talking about, you know, the bad stuff that they've done, let's help each other out.
Yeah.
So anytime you start to feel frustrated, think to yourself, tolerance, how can I be more tolerant? How can I be a more respectful member of this community? And really try to be more understanding of what people are going through.
I get frustrated and complain about things. I gotta write down my 4-step now. My sponsor's on my ass.
And another thing that I want to mention, right? So, have you guys heard of this whole housing first model, right? So, we are basically being told as staff that we need to house you, and then house you first, and then we need to help you figure out how you're going to keep that housing, right? So, but sometimes the housing comes before the skills. So we do our best to try to teach you the skills before you get housed, so you'll keep your
money
housing.
management classes, you know, credit card classes.
Yeah.
You know, I did all that stuff.
Yes,
You know?
but not everything you're also going to learn here at Safe Landing. Sometimes you might need to be connected to a resource out there in the community and really figure out what you need to surround yourself with. So if you need a sponsor, you need a class, you need a gym to go to, right? Those might be the 3 things that are going to keep you stable. So that's what we're here to help you figure out. But sometimes it doesn't happen while you're here at Safe Landing. It might happen after, like Egypt suggested, you can be a part of our wellness center, right? So they're an outpatient program who can then help provide this additional support if that's what you need, okay? So I hope that answered quite a few points.
Yeah, I think that that's really important too, to know, that it's ongoing. It's not like you have like the end destination of getting housed and then that like solves everything.
Nor is there it's 6 months for everybody, right? It's different for everyone.
And it's definitely a gift we can all give each other, is showing each other that grace, because we don't know what is causing that behavior. Some of the behaviors you described, actually, right? I have patients who have excrement on their walls. It's because their brain doesn't work the same way as ours, right? So we have to really be willing to give them grace. It doesn't change the fact that I don't want that person, I don't want them locked up in a hospital. I do want them to live in the community. I will fight for them to get an apartment, right? But yes, the trade-off is I have to show a lot of grace when my team has to go into a home that may have urine and feces everywhere, right? But part of it is one foot in front of the next. And my goal is I hope we can keep him out of the hospital, keep getting him the help he needs, and we will take those baby steps to address those things. And I'm glad that you're here to help your neighbors out. I hope we can all kind of try to keep that in mind, that we're all living for this life the best we can, and we show each other and ourselves the grace that we need and honestly deserve.
I think that's enough.
Well, I was just thinking, because I was talking to Michael, who is a friend of Toto, who would have known? And he was saying, like, you know, he for him it's like, well, it's just what I understood from what he said, you know, when am I going to get housed? I want housing, because Toto lives in the Mayfair Hotel. Ooh. And he was like, how do I get into the Mayfair Hotel? And I honestly don't know what to tell him. And because the problem is there's not enough housing, a lot of people can't get housed even. So how do you deal with that problem? Like, you know, people get impatient and you just cannot give him the housing that they want. How do you deal with that? Yeah.
I tend to encourage folks to, you know, focus on other goals, right? There's always something that you can do to improve yourself. So whether it's to take a class, whether it's to make a list and organize yourself so that when you're in your new place, you'll be more set, right? So those are some of the ways. And then art, we talked about art. You know, we do a lot of recreational things here to help pass the time a little bit easier. But yeah, I think goal setting is a really great way to make use of that time in between moving to your new place.
I'll add time scale, I think is important too. Like you had mentioned, so often we're just trying to think, get it through today, get through the night. We have to think about the long game. Honestly, it's something I really try to work with the patients on, even when we talk about things like the vaccines that we talked about earlier. It may not be today's visit, it may be in 3 visits, 5 visits, but it really is like slow trust building, it's relationship and understanding building. It's the person knowing that I'm not going to give up, or we're going to try and keep going together, which means let's buckle in. And this may be something, a conversation we're going to be having for months or years to come. And a beautiful example is when I came here today, how many patients did I see here that, you know, that means they're folks that have been to other shelters that I go to. They're folks that I've seen in the hospital. And yet I walk in the door and I'm like, hey, it's you again. We're still here and we're still in this together. And that's really important that we feel that sense of belonging. We're all in this together, that we're trying to take care of those pieces of the puzzle, whether it's addiction, whether it's mental illness, whether it's a medical condition, financial troubles. And so little by little, I think that perspective of it's broadening up to this future that's ahead of every one of us, that gets us through not just today, but the next days, the next weeks, months, and maybe even years to come. And how beautiful then we're building our own little village, community, networks, friends. And I hope, honestly, I keep seeing and interacting with every one of you. Many of you in this room right now, I have crossed paths with in many different ways, and I'm thankful for each of that. And I hope we keep doing that for years to come.
That's a good place to end for now, but I would encourage these conversations to continue, and thank you all for being part of this discussion.